So welcome to Catholic Wellness Answers. Going to get our presentation pulled up here. We've got a lot of exciting info to share with you. So something that we've been desiring to offer you is Catholic Wellness Answers. And this is episode 1, your everyday aches and pains. But more importantly, we want to share about what you can do about those aches and pains, because we all want to feel better and keep at the things that we most enjoy doing. So this event is hosted by MyCatholicDoctor. And what is MyCatholicDoctor? So MyCatholicDoctor is a nationwide organization that offers telehealth services to anyone who desires high quality healthcare from a Catholic perspective. Services that are convenient, accessible, and get results. So our mission and desire for the outlet of this group, the MyCatholicDoctor Wellness Connection, is for you to be able to connect with Catholic providers of various specialties who share your values, and for you to connect with each other. We want you to be able to ask questions, find out what other families are doing to work through the health issues that we all face. For the future too, we welcome you to send comments on picking future topics. You can always send a message or an email. We really want this to be about you and what you're needing. So as we go, feel free to write up questions and always just kind of giving us feedback on anything for the future that you would like to see as well. If you have any personal questions that you'd like to message me individually, that you're totally fine to do that as well, and I look forward to it. So my name is Dr. Jillian Stecklein. I'm the Director of Physical Therapy for MyCatholicDoctor. And what do PTs do? So physical therapists are movement experts. We help you to improve movement, reduce pain, and return to the activities that you love doing. And why did we choose this topic? So it's the new year. It's been a different type of year. Lots of people have been working differently this year. Your everyday aches and pains kind of applies to almost everyone. And so I'm sure there's something that you can find of value, be able to take away from this presentation. So we're excited to offer it to you. What we're going to cover is what common issues I see in the clinic with everyday aches and pains, where they come from, why they happen, and of course, what we can do about them. And that'll be the topic that we really dive into. So what are the aches and pains experienced with working? So a number of areas can be affected by work, and this can result in pain in the low back, the hips, the neck, the shoulders, depending on your setup and your type of work. I'm kind of going to break up work into 2 main types of work. One's going to be desk work, and the other one's going to be requiring repetitive movements. So think things like dental hygienists, cosmetology, lifting boxes, reaching onto shelves, activities that would require repetitive movements. So with the issues at the desk, what tends to happen for people is we're sitting, our hip flexors get tight, we get restricted blood flow, even blood kind of just pooling in our legs, so not great circulation. We start to hunch over our desk, poke our chin forward at our computer. All these muscles can get tight through here. Again, they're turning on when our deeper postural muscles are supposed to be firing, and that ends up leaving aches and pains kind of in those muscles that are being overused through there. In terms of repetitive work, think of someone up on a ladder using a hammer like my dad does, and we've got him on a great home program for that. Overuse injuries like we talked about, dental hygienist, or anything that requires multiple lifting times a day, being up on a roof, climbing a ladder. What happens with these injuries is they're usually stem from a lack of global stability or postural stability. So people tend to end up overusing the same mechanics or muscle groups over and over again. However, we're going to talk about this in a bit, but if we can get some of those deeper postural muscles strong, we're able to offload those extremities a little bit and not overuse those smaller muscles as much. So there are things that we can do for that. And then there's a new group of issues, which I have called quarantine issues. So this year it's been interesting to see in the spring. So there's not going to be spring sports. Like, what might people be coming into the clinic for? But there were plenty of things. There was lots of things going on. One of which was people doing a lot of yard work and having issues with that. New desk setups. So people moving their offices home. Maybe you had that great chair at the office that really supported you. Now you're doing a homeschool with the kiddos and you're sitting on that hard dining room chair trying to get your whole little desk setup going. Some people return to a new activity after taking a break. Some people took a break from exercise for a couple of months and then tried to go back full force, and that didn't always go too well either. So some injuries seen there, or trying something new that the body was not prepared for. You know, we all got outside more. Maybe you tried mountain biking for the first time ever because you had some spare time and you wanted to go outside. And so there was all sorts of different new quarantine issues this year. So we want to talk about what can we do about it. So we've discussed the what can happen or what might you experience, as well as why this happens. But what really matters to your daily life is what we can do about it. So lifestyle factors. We're going to go over some general principles, and then we're going to go over some more specific things that you can do. But lifestyle factors, they play a huge role in our overall health, of course, but they also matter for how we feel during the day and after work as well. So the three main ones that we're going to cover are exercise, nutrition, and mental health. So exercise. Daily activity is important, and I actually like to call it movement. Because getting a workout in 3 to 5 times a week for greater than 30 minutes, that is awesome. And it should absolutely be a part of your routine. But if you're still sitting at a desk all day, we still need more movement during the day, or you can still be at risk for injury and other chronic health issues. So an example of that is I have a client and he works at a bank and he's sitting during the day and working on his computer, and then he'll go do about an hour of good intense workout every day. But he's still seeing some difficulty with being stiff. He's lacking mobility in his hips from going straight to his desk to trying to do a workout. He's not able to have quality workout form. And so, then he's trying to lift overhead after sitting over a computer and trying to lift and press and causing some shoulder achiness and impingement through there. And so the point is that we also just need to be moving, outside of work and everything like that too, so that we're just really supporting the body for the activities that we desire to do, and getting on a home program where you get that mobility back through different parts of the spine and get a little bit stronger in your core, and you're going to be able to go back to those activities. So if we're not moving outside work, we're still at risk for those metabolic diseases, heart disease, cancer, and really just not being able to function at our best as we're called to. So going into that a bit, balance is also important. Our bodies, they're a gift. They're meant to be cared for. They're entrusted to us, and they're the vessel in which through we live our life. But they're also not meant to be an idol. So we're not striving for, just physical perfection for the sake of that. We are just doing some small things to help us be a better version of ourselves. Next one is nutrition. Now, what we eat highly affects how we feel. If we're giving ourselves lots of sugar or processed foods throughout the day, we're going to keep reaching for more sugar or caffeine to make it through the day. Processed or packaged foods, they're also typically high in inflammatory oils and sugar, and those things can really aggravate our pain levels. Foods that would give us quality energy will help you feel better. They'll give you more energy for the many demands that you have in your day. Along with this is proper hydration, and I've had this discussion with many patients, but pop and other caffeinated drinks do not count as water. I've had this discussion so many times. We want to focus on water, low sugar electrolyte drinks, maybe lemon water for really nourishing, being able to get in some of those electrolytes as well. Keep it handy throughout the day. Refill it often. This is really going to help your body to filter out toxins and to provide nourishment to your tissues through your blood flow. Next is not discussed enough, and that's why we need to discuss it, is your mental health. So research shows when facing issues such as anxiety, depression, and PTSD, that the body can take longer to heal. Oftentimes, issues such as chronic fatigue syndrome, fibromyalgia, or widespread pain issues, even healing times for surgery can be longer when some of these mental health factors are affecting us, such as the anxiety, the depression, the PTSD. So in this case, the body is really having to focus its energy in different directions. And people can find themselves living in that fight, flight, or freeze mode, which is a sympathetic nervous system activation or a ramped up nervous system. Whereas the goal is homeostasis with a more balanced sympathetic and parasympathetic activation, as opposed to what we can tend to see in anxiety, depression, PTSD, is that we really spike that sympathetic nervous system and there has to be a crash after to balance that out. So what people find is that they're living in more of a survival mode. And when we're living in that survival mode, our body is not able to do a lot of those maintenance tasks, which is just kind of taking care of the wellness of the body. It's focusing on those priority tasks and changes things like our digestion, our pain, and other factors in our body. So it's important to seek care for these issues if they're affecting your day-to-day life. As we all know, they kind of trickle in and end up impacting every part of it. Going along with that is sleep. Really important to have a quality sleep hygiene program. So things like making sure we go to bed and wake up at the same time each day, having our room set up for success in terms of having, maybe blackout curtains or a really quiet space or a good sleeping temperature. Making sure that we're not doing a lot of screen time before bed or eating a lot before bed, and just having some of those things in place. And that's one of my favorite things about My Catholic Doctor is, we have experts in sleep. We have great counselors. We have great physicians. We have physical therapists, and being able to give you all of these wellness pieces in one place. And that, as we all know, so many of these factors are very multifactorial. So being able to pull out your needs in order to feel better during your day so you can reach your goals is very important to us as well. So in wanting to feel better throughout the day, it's important to remember the holistic nature of our minds, bodies, and souls and what it really means to be well. So taking all those factors into account. We're going to move into a bit more of the practicals now of how to do this. So we're going to start by creating habits and routines. A lot of these health factors come together, not in big changes, but in small habit-based changes that accumulate over time to create sustainable change in your health and wellness. I know at the new year, so many people want to make those big overhaul changes, but we all know those big plans don't usually last. We get off track one day and things just seem to fall apart. But if we're going to make progress in our family life, our spiritual life, our lifestyle habits, we need habit-based changes over time. And that is what we want to offer you. So we're going to be putting in our links the 1-minute muscle manager to give you something really practical to take away. And this is a video that I've created in the past. It's a series. The exercises are very basic and they can be completed at work during your day. You can complete the 1-minute routine once an hour, ideally, and it's going to really help you to maintain blood flow to the tissues, to activate some of those postural muscles that we were talking about, to stay a little bit more up and active, whether you're at a desk or you're standing up. So it's going to get into each areas of the body, a little bit of the hips, back, the upper body, and performing this is going to help you keep a little bit of mobility through those tissues, as well as just the muscle activation like we talked about. And what that helps you with is reducing risk for injury, helping you prevent those everyday aches and pains. It's something simple to add into your routine too that's already made for you. And you can feel free to just, play that video, once a day, just get the hang of it. And then, by a week or two, you'll probably have it memorized and you'll be able to do that whole routine on your own. Now, your coworkers may make fun of you at first, but when you start doing it, but once they see how your mood and your energy and your body are all doing better, they're going to want to find out what you're doing too. So you can share that video with them. Some workplace principles. So ergonomic setup, extremely important and a little bit more difficult in the work from home environment. So for your desk setup, we really want to have your feet flat. We want to be able to maintain a neutral spine. So we don't want to be all hunched forward or kind of shifted over to the side. We don't want to be sitting on the edge of your chair. We want to be able to have relaxed elbows and wrists. We don't want a super grippy forearm, and that's definitely going to put us at risk for those tendonitis type issues. We really want your screen at the appropriate height. We don't want to be poking your chin forward or hunching over to be able to see your screen, although we know we've all done that when we're trying to get something done. We want to have a supportive chair. And if you're at home and you don't have that as supportive chair, we may need something like a little pillow support under your bottom or behind your low back. And a couple of notes on your standing desk. A lot of people are starting to do standing desks, which is great. We're being up and more mobile. But if we're standing at our standing desk in a static position and still not moving, we can still see some of those same issues just from being in a static position. We also want to make sure we're not like slouching our hips to the side or really leaning into our desk. It might be better to have a desk that can go up and down so you can take those little breaks and then stand again. Or even doing some sit to stand. So standing up and sitting down a few times in your chair is a great way to get a little blood flow through your legs as the day goes on. Now, with those jobs with the repetitive movements, the best things when you're doing a lot of repetitive movements is to have a really strong core. When I say core, I don't mean strong abs. I mean having your deep postural muscles strong in your deep core, your thoracic region, or your shoulder blade region, and also your neck, so that we're just really strong and stable. If we're using those muscles as we lift and we're using them in the right order, which is what PTs help to train you on, you're going to be able to not overuse those smaller muscles kind of further out from the spine. And those overuse injuries, you tend to not use a lot of the deeper postural muscles or your bigger muscles. It tends to be an overuse of those smaller muscles, and that's why they just can't handle that over the repetitive time frame there. And that's what PTs help with. So what do PTs do? It's highly valuable to have a therapeutic relationship with a provider you trust, you know, a PT that you could go to right away with a question or concern about symptoms that you're experiencing. And like we talked about, physical therapists are movement experts. We can help you to improve movement, reduce pain, and return to the activities that you love doing. And our goal as a PT is always to empower you to take ownership over your health and to guide you to your goals through a plan that's individualized and meets your unique needs. So who would benefit from physical therapy? Well, if you're experiencing pain that's not resolving on its own with rest or self-care for over 2 weeks, patients with a chronic or ongoing issue that's limiting them. So like you were not able to do something before and you'd like to do it now, or you used to be able to do something and you can't do it now. Or if you have a new goal, you know, such as having the proper mechanics for getting on the floor with your grandkids or being able to run your first marathon. Maybe you're upping your mileage and you're starting to notice pain in your hip. We really want to get into those issues before, you know, you have to cancel the race or you're just not able to be able to do those things. So at My Catholic Doctor, we are a resource to you. We have PTs offering services in states throughout the country. We're happy to help you if you have a personal concern regarding these workplace aches and pains, but we're also able to assist with a lot of other things as well. Prenatal care, postpartum healing, sports injuries, headaches, any of those extremity issues that we discussed today, you know, we're able to address and get you care. So what a telehealth visit looks like. So you would go to MyCatholicDoctor.com and you select your state and you're able to see a list of providers in your state that are able to give you care in various specialties. So you're able to select your provider and make an appointment with them directly through the My Catholic Doctor website. And what a telehealth visit looks like in PT is we do an evaluation. I want to hear your story. I want to find out what's going on, what's feeling limited, you know, what is your goal? What do you want to get back to? And from that, we're able to screen your movement. We are able to assess what's going on with your strength, your stability, your balance, and provide you with specific things to do at home, whether for mobility or strength or stability, whatever it is that you need in order to reach your goal through that system and through building that therapeutic relationship and being able to offer those services to you in your home that are convenient and accessible and can get you the results that you're looking for. So typically a plan for a telehealth PT is about 4 to 8 sessions, and that's based on the severity of your issues as well as how long they've kind of been going on. But there's so much that we can teach you and walk through with you to get you feeling better and back to what you love. So My Catholic Doctor can accept insurance, health shares, cash pay patients, and so we strive to have excellent care accessible to all. Because everyone deserves to have their needs met and taken care of. And so you can always message me with additional questions as well. So I want to thank you for joining us on our first episode of Catholic Wellness Answers, and we look forward to seeing you next time. Thank you.